Good afternoon, everyone. Welcome to the third day session of the 7-day Faculty Development Program on Evolving Research Paradigms in Forensic Science. We are delighted to have you all in our midst. Autopsy is a word combining virtual and autopsy and employs imaging methods that are also used in clinical medicine, such as computed topography, CT, magnetic resonance imaging, MRI, etc., for the purpose of autopsy and to find the cause of death. Autopsy can be employed as an alternative to standard autopsies for broad and systematic examination of the whole body, as it is less time consuming, aids better diagnosis, and renders respect to religious sentiments. Autopsy is quickly gaining importance in the field of medico-legal cases, and there are many doubts still in the air regarding its efficiency, legal admissibility, and expenditure among forensic professionals. We have in our midst Dr. Hemanth Naik, Chief Medical Officer at Virtual Autopsy India. Sir spearheads the operations of the Virtual Autopsy Company in India. Sir earned his MBBS degree from the Rajiv Gandhi University of Health Sciences, Bangalore in the year 2003. Later went on to complete a diploma in forensic medicine due to his interest in the field, and also a diploma in forensic odontology and a fellowship in preventive cardiology. Other than his mainline studies, Sir has earned certifications in humanitarian science and has a great passion towards disaster victim identification and humanitarian forensics. Sir has published in many conference proceedings and has more than 10 highly acclaimed articles in reputed journals. Sir is also a full member of the International Academy of Legal Medicine, Geneva. On the professional front, Sir started his career as a resident doctor in the Department of Forensic Medicine at Bangalore Medical College and Research Institute, and later followed his passion to become the senior scientist and medical liaison manager of the Digital Autopsy Deployment Center at iGene at Kuala Lumpur. Sir has been the module coordinator for medical ethics and pathology at Newcastle University, Malaysia. Since 2018, Sir has been working as a forensic pathologist at the Blake Emergency Services, UK, and was deployed to many disaster sites. Sir also works as the Chief Medical Officer at Virtual Autopsy Company based in the UK and takes care of the Indian division of work. Sir's interests are in the field of disaster victim identification, autopsies, and humanitarian forensics. With such a relevant career and interests, Sir is the best suited resource person for this lecture, and we thank Sir for accepting our invitation to be with us. Now over to you, Sir.
All right. Good afternoon, everyone. Devi, thank you so much for all the kind words. And I think we'll start the presentation because I have only 1 hour, and I don't think I can finish all of it in 1 hour, but I'll try to make it. Yeah. Right. Okay. It gives me an immense pleasure to take this session for the faculty development program. So, a virtual autopsy. Before we talk about virtual autopsy, let's talk about autopsy. Autopsy is basically done to determine the cause of death. And there are only 3 possible causes of death. Either it can be because of a pathology or a disease, or it could be because of a toxin, or it could be because of trauma. So there are only 3 possible causes of death. So when we do a postmortem, we will try to identify one of these to determine the cause of death. So now coming to what is virtual autopsy? Virtual autopsy is basically examination of the dead body without opening it or with a minimal invasive techniques. So it's basically scanning of the whole body in the CT scanner from head to toe, and transfer of the data onto the server, and then download them onto your computer, into your software to examine the body. So here in this particular screen, you're seeing the skin layer, the muscle layer, and this you're seeing the lungs. So you basically examine everything, and then you try to determine whether the person died because of a poison or a trauma or any pathological disease. And the main advantage, I'll talk about the advantages later. So how do we do it? So it's basically at first when the body comes to the mortuary, we do physical examination. So during physical examination, we estimate the post-mortem changes on the body as rigor mortis, liver mortis, skin changes, and so on. And then if there are any external injuries, we note down the external injuries and also the identification marks like the moles and so on. And then we subject the body for a PMCT scan. And then we do the PMCT analysis on our software. And then if required, we will go for biopsies of the tissues for histopathological examination. And we'll also collect the blood for toxicology analysis. So based on these three, we come out with the cause of death. So this is the basic procedure on how we do it. And when you scan the body will have three images in three planes: the axial plane, the coronal plane, and then this sagittal plane. So the pathologist would be able to see all the three dimensions of the body in 2D in all the three planes. And the 3D can be rendered for any organ. And here in this case, you're seeing the heart, and then you're seeing the bronchial tree, and again the heart and the vessels. And here you're seeing the lungs, the lung window, and then also you're seeing the 3D of the bronchial tree. Then we have a technique called postmortem angiography, where we inject the dye into the patient's arteries to visualize the arteries and the vessels. And here in this case, you are seeing the cerebral artery and its branches, and also the circle of Willis on the right hand side. And here you can get a better idea on every plane. You are able to see the body in the skin level, also the hollow viscous organs, and also with the muscle layer, and also with the bones. So now I'll talk about few case studies using virtual autopsy techniques. When a case of trauma comes to the mortuary, and when we do a classical autopsy, we try to look for any organ injury, and we try to look for any bone injury. And then we try to establish if there's any hemorrhage in the brain or in the thorax or in the abdomen. And this procedure usually takes 2 to 4 hours. And after examining these things, we will conclude saying that death is due to trauma because of a multi-organ injury or a multi-bone injury and so on. And when you do a virtual autopsy, you can see the organ injury in the virtual autopsy. You can definitely see the bone injury in virtual autopsy. You can definitely see the hemorrhage in virtual autopsy. But the hemorrhage, the way we measure it in virtual autopsy is quite different than the classical autopsy. In classical autopsy, we basically collect the blood into the bottle, and we try to measure it and see how much of blood has been oozed out, or how much of blood has been excavating out of the body. And here in virtual autopsy, we have Hounsfield units. Hounsfield units are the numbers which will help you to determine the type of tissue. And we also have the volumetric analysis of the slides. And the whole procedure to scan the body will take only 2 minutes. And there are a lot of paper publications which has explained about the importance of virtual autopsy in traumatic cases. And here are a few references where you can see at the down the corner. And here is an example. On the right hand side, you're seeing the actual autopsy done, and we are trying to determine the fracture of the spine. And on the left hand side, you can see the whole of the skull without, whole of the bony structure, the rib cage, and the cervical and the spine, and you can easily point out the fractures. And here there is a collapse of lung, which is easily shown on the virtual autopsy. And there are again a lot of paper publications which talk about visualization of the wounds and detection of the bullets and the bullet course in case of gunshot injuries. And here in this case, you can see the star-shaped contact wound, which is a case of a gunshot injury. And it's very easy to track the bullet track and easy to determine the bullet fragments. Next, coming to sudden deaths. In classical autopsy, when there's a case of a sudden death, or when the person has died because of pneumonia or because of heart disease and so on, we try to identify the organ pathology. And then we want to know the size of the organ, whether the organ was normal or abnormal. And we will also try to measure the weight of the organ. And we will try to look into the internal hemorrhage as in case of cerebrovascular accidents, as we call it as stroke. And it usually takes around 2 hours. In a virtual autopsy, you can definitely see a lung, but you can definitely see the organ pathology. And we have the internal algorithms where the software will help you to measure the size of the organ and also to weigh the organ. And you can definitely see the internal hemorrhage, and the whole scan will take only 2 minutes. And normally when you do a CT scan, a postmortem CT scan, and then you identify a pathology, let's assume you identify the pathology of lung, as in a consolidation of the lungs. But you want to make sure that it is definitely consolidation of lungs. So we will take the histopathology of the lung tissue with the help of the needle-guided biopsy. As you can see here, you're basically taking the sample of the brain, and you can send it for histopathological examination to determine the cause of death. And my question here to the audience is, when you have scanned the body and when you know it's a case of a lung pathology or a liver pathology, we don't have to open up the whole of the body just to get a piece of lung or liver for histopathological examination. We can just do it with the help of CT guided needle biopsy, and we can avoid the complete dissection of the body, and we can go with the minimal invasive autopsy. And I'm sorry, there was my friend in the room. Yeah. So when it comes to postmortem examination of the organ weight, we have a technique to weigh the organs. Next, when most of these sudden deaths nowadays are because of chest pathology, so mostly because of acute heart failure. And the other possible cause of death, which could be pleural effusion, consolidation, aortic dissection, hemopericardium, and hemothorax. All these cases will be able to be diagnosed by virtual autopsy. As you can see here on the axial slice of the chest, you can see the lung base, which is showing dependent density, and which is basically the of the coronary arteries, and you're able to visualize the coronary arteries. And we have a scoring called as calcium scoring of the arteries, which will help you to determine the extent of the block in the arteries. Next, coming to hanging, the findings of pneumomediastinum and cervical soft tissue emphysema is being studied in Japan, where they say that when there is a collection of a gas or air in the cervical region, it's the indication of a prolonged hanging. And you can also definitely determine if there's any fracture of the thyroid cartilage, hyoid bone, and so on. And they have done one comparison study where they try to compare it by opening it and also by doing a virtual autopsy. And here in this case, you can definitely see the hyoid bone and the inward fracture of the hyoid bone. Next, COVID-19. I wish we had virtual autopsy during the COVID-19 because during the COVID-19, there were a lot of deaths, and most of the times they were straight away sent to the burial site. And if we had scanned all those bodies, we would have had a lot of data about COVID-19, which would have helped the researchers to understand the disease much better than now. And the Royal College of Pathologists gave a statement saying that the virtual autopsy would be a very, very good way of investigating the COVID deaths, and it reduces the risk of infection. And PMCT is more sensitive diagnostic method in disease on whom RT-PCR was not performed. Next, coming to the advantages of a virtual autopsy. It's less time consuming, as you know, and less manpower and resources required. It doesn't mean that we are taking out the job. We are basically trying to upgrade the skills of the forensic pathologist. We are trying to upgrade the techniques of the mortuary technician. And we have the clear recording and its infection and biohazard control. And the main important thing is you can hand over the body back to the relatives as quickly as possible. And the family would have been already in pain, and they would have to wait half a day or sometimes the whole day, depending upon the caseload. And that would increase their trauma more. So with the help of virtual autopsy, we can minimize that time. And there is uniformity in reporting, in the sense there won't be any subjective findings in virtual autopsy. All the findings will be objective findings, and it's very easy to get a second opinion about those findings. And the storage of the bodies is reduced. Say, for example, you have a case of a disaster like a bus accident where there were more than 20 deaths, and some mortuaries won't have the technology, won't have the infrastructure to store all the 20 bodies. So it would be very difficult to store those bodies all together at one given time. And when you have a virtual autopsy, it will be easy to hand over the body back to the relatives. And all the body parts can be recorded, and health and safety well maintained. I was talking about the mass disaster. So now we will have the digital storage where you can store how many ever bodies you want digitally onto your server. And yeah, it's the same. And next, coming to the most important thing is education. So the digitally records will help the medical students to learn more about the diseases, to learn more about the pathologies, to learn more about the trauma. And we can perform virtual autopsy multiple times on the same body, and you can reset it again. But you can't do the same when you have the actual cadaver. Once you open it, it's done forever. But in virtual autopsy, when you have a 3D cadaver onto your dissection table, you can definitely play around it, and you can reset it again. And here you are seeing a table, we call it as the virtual autopsy table. It comes with the 3D anatomy, and also it comes with the scanned bodies, and it will be helpful for the forensic graduates to study more about the pathology of the disease, or at least to study about a virtual autopsy. So we are basically a UK company, and now we have opened a branch in India, And we have started a business in India since August 2022. And we have done few projects around the world. We have done in Hospital Kuala Lumpur, Malaysia, which was in 2010. And and virtual autopsy is done for all motor vehicle accidents and sudden deaths. And they do a lot of research and publications. We have done 4 projects in UK, Sheffield, Bradford, and Sandwell, and also Leicester. And we provide 3 types of service, 4 types of services. I don't think it's required. I'll just skip this slide. And this is the actual PMCD workstations which we have in the UK. The PMCD scan with the dead body about to be scanned, and the workstations. And we have the mobile virtual autopsy trailers. As you can see here, it comes with the scanner and the workstation within it, and it's all built in the UK. And you can carry it anywhere, and you can install it anywhere. And as of now, virtual autopsy is practiced in a lot of places around the world, mainly Australia, Malaysia, Japan, India have started recently, and most of the European countries have started it. And we are actively working on these 4 regions, mainly Philippines, India, South Africa, and Kazakhstan for the year of 2023. And thank you so much for the talk, and thank you so much for your time.